ice cream for inoculations. Russia's authorities say they've been doing what they can to encourage people to get the COVID shot for almost a year. But only about 1/3 of Russians are fully vaccinated. Reservations remain about the Sputnik V jab and the government's push for it.
They shouldn't force us. They should try to motivate us.
With a low vaccination rate and currently around 40,000 infections per day, it could be a bleak winter ahead. Welcome to your COVID-19 special. I'm Chris Colbert in Berlin. Moscow is back under its tightest lockdown restrictions in over a year after daily COVID-19 deaths hit another new record of more than 1,100 recently. Now, non-essential services will stay closed until the end of the week. Despite the surge in cases, the majority of Russians have yet to heed urgent calls to get vaccinated.
A new day, a new tragic record. As the highly infectious Delta variant continues to spread, Russia's COVID wards continue to fill, primarily with the unvaccinated. Images of patients infected with the coronavirus have become a fixture on Russian news programs, but they have done little to convince a skeptical population to get vaccinated, forcing the authorities' hand. Moscow's mayor joined other regional leaders, declaring an 11-day soft lockdown for the capital, closing bars, cafes, theaters, and other public spaces. It coincides with a federal week-long work holiday and stay-at-home orders for the elderly and vulnerable. Authorities hope the short firebreak will help them weather the pandemic's fourth wave. Health experts welcome the announcement, but warn it's too little, too late.
11 days isn't enough at all. It's another example of a half measure and an attempt to please everyone. But you have to keep public health in mind. In the current situation, we can't use abstractions. We're talking about real deaths, real illness and long COVID. We have to put a stop to it.
Vaccinations with Russian-made Sputnik V have increased in recent weeks, thanks to government mandates and new restrictions, doubling to around 300,000 a day. But overall, only around 1/3 of Russians have gotten their first shot. Of the rest, some say they'd rather wait for an international vaccine, but around half don't intend to get vaccinated at all, including many medical personnel, provoking growing frustration among the country's medical community.
People aren't behaving correctly. It's sad to see it. Russia produced a great vaccine, Sputnik V. I have full confidence in Sputnik. It's comparable to vaccines produced in the West. Why don't we use it? I don't know.
Frustration is also spreading among many in the service industry. The branch was especially hard hit by previous lockdown measures, and now they say they're paying the price for Russia's vaccine hesitancy and preparing for a long winter.
We're looking at how we're going to survive the next lockdown. I think everything is going to be much harder because everyone understands this is just the beginning and it could go beyond the 8th of November. But we're just going to have to deal with it.
As the Delta variant continues to spread, government officials warn Russia's fourth wave is only likely to get worse.
Let's talk more about the situation in Russia with Anton Barchuk, head of the European University's Institute of Interdisciplinary Medical Research in St. Petersburg. Welcome to DW, Anton. What is your explanation of many Russians' vaccine hesitancy?
Yeah, hello. And of course, unfortunately, we knew about this problem with vaccine hesitancy before. So it's not something new, just the pandemic has highlighted this problem to everyone I know. But I think the issue is the lack of this culture of vaccination in adult population. We do not have any other population-based vaccination programs in Russia in adults. So we have flu vaccine, but only part of population is accepting that, and we don't have national HPV vaccination program. And yeah, I think it's goes beyond the pandemic. So it's a problem with vaccination.
Well, vaccination seems to be the way out of the pandemic. What attempts are being made in Russia to combat this hesitancy? Who is promoting the vaccination campaign and how?
I think that one of the problems is a lack of trust, and the government, of course, the state is promoting vaccination, but there's a lack of there was a lack of convincing data showing that vaccination is effective, vaccination is safe. For example, in many other countries, we have seen many publications which are related to safety and effectiveness of the vaccines. In Russia, we have only one publication, Lancet publication of Sputnik V, and until the last month, we didn't have any other available data on the vaccine effectiveness and safety. That's one of the problems, this problem of lack of the data, lack of trust.
Now, in some cases, Anton, vaccination is already compulsory for certain job groups, such as shop assistants, waiters, lecturers. Does it help, or does it only fuel the resistance against vaccination when there is hesitancy already in place?
I think it helps, but it doesn't help a lot. So some people also, those so-called COVID passports, kind of QR codes, which are used in Russia, also helping a bit. We at the moment have a bit more. The proportion of those who got at least one shot is a bit more than those who plan to have it in the beginning of pandemic. That's a good thing, but still, it's not. I mean, changing the global situation.
Now, you mentioned that people may be lacking a lack of trust when it comes to vaccine. If we talk about Sputnik V, the Russian vaccine, medical experts say it is fine. Russian experts say it is fine. International experts say it is also close to vaccines that are being produced in the West.
Yes, it is. Sputnik is fine, and we got our independent data showing that it's quite effective, and we have data from other countries, from San Marino, from Argentina, that it's safe. So it's fine, but I think the introduction, the way it was introduced, it was a bit wrong. So it was introduced before any data, any results were published. And also we have two other vaccines. Fortunately, they are not so widespread, Covivac and Epivac Corona, and we do not have any data on those vaccines, although they were introduced already and for population. So I think that's also kind of the population, they were a bit confused the way it was introduced, and they were like saying that it's 100% effective, although no data were published at that point. Yeah.
Russian President Vladimir Putin has called on the military to build more medical facilities for the rapidly growing number of COVID-19 patients. What scenario do you expect in the coming weeks?
There's this vaccination, and we need to increase the uptake, the vaccine uptake. But there's also we have, at least in St. Petersburg and in other big cities, we have quite a big proportion of population who had COVID-19. So they have immune defense after the infection. So if we combine those with those who took the vaccine and those who had COVID infection, maybe we are near the kind of new herd immunity threshold, which is a bit like almost, I think, above 90% for Delta variant. So we'll see what's going to happen next. But at least during this wave, although there are no measures, nothing is controlled. Right. The number of cases is not as high as in summer or in winter.
Right. Epidemiologist Anton Bartchuk, thank you for your thoughts.
Thank you.
Russia's neighbor Ukraine has an even lower vaccination rate, with only around 17% of the population fully vaccinated. That's one of the lowest in Europe. The capital, Kiev, is now taking steps to change that by restricting access to public transport and venues for people who remain unvaccinated against COVID-19. Non-vaccinated residents will no longer be able to go to work and visit public places unless they have tested negative. Restaurants, hotels and fitness centers will remain open only if all employees are vaccinated or have negative daily tests. Now it's time for one of your questions. Here's our science correspondent, Derek Williams.
Are there places where life has returned to normal?
I don't think that normal life is really a term that we should use anymore, because people say it when they want to describe life before the pandemic. And like everything in the past, that's never coming back. The world has moved on. Hundreds of millions of people have been infected with COVID-19, and over 5 million people have died from it so far. But I bet there are places where the coronavirus maybe hasn't dominated the discourse as heavily as it has here in Europe. Believe it or not, according to the WHO dashboard, there are around a dozen countries still reporting 0 cases of the disease, but nearly all of them are small island nations in the Pacific. Now, I really have no idea how people there feel, but maybe they still live lives largely free of the fear of infection. To call that normal, though, is, I think, probably a stretch, because strict rules on travel to keep out the disease, I would guess, have likely devastated livelihoods in places like that, which depend heavily on tourism. In a few other places where the pandemic hit a lot harder, but authorities now seem to have it at least somewhat under control, fears appear to have subsided somewhat, but they aren't banished completely. Here in Europe, for instance, most Scandinavian countries dropped nearly all of their domestic COVID restrictions back in September, hoping that high levels of vaccination had turned the tide. But as winter approaches, climbing numbers of infections there and in other parts of the continent have thrown doubts on whether at least some measures might have to be reintroduced. So, long story short, I'm guessing that life hasn't really returned to normal anywhere. But as I said at the start, I think that's become a pretty relative term.
And before we go, opposition to coronavirus mandates has been growing in parts of the US, like in New York City, where vaccine mandate opponents held a nighttime demonstration on Staten Island. The protest came after about 9,000 of the city's 300,000 municipal workers were put on unpaid leave for refusing to comply with a new rule requiring them to get vaccinated against COVID-19. Thousands of city firefighters called in sick in an apparent protest over the requirement. The mayor says there have been no disruptions to city services. That's our show. Thanks for watching.